Public imagery usually equates depression with crying in bed and anxiety with hyperventilating, but the clinical reality of these conditions is rarely that obvious. It often presents as a man masking his pain with sudden, heavy drinking, or a high performer experiencing an extreme, unexplained physical fatigue that no amount of sleep can fix. Stripped of stereotypes, depression is a persistent low mood and a loss of interest in pleasurable activities. Anxiety is a state of uncontrollable fear, dread, and persistent worry. Because these medical definitions are often misunderstood, millions of people suffer in plain sight. They don't seek help because their internal pain doesn't look like the version seen on screen. Biological sex further complicates how these symptoms manifest. Data from the University of Wollongong shows that while the core illnesses are identical, men and women express that distress through wildly different behaviors. This chart maps depression liability. The dotted curve for women shows a high probability of internalizing symptoms, like appetite loss. The solid curve shows men are more likely to mask symptoms through externalizing behaviors, like intense irritability. This variation in outward behavior masks a deeper mystery in how these conditions overlap internally. Up to 51% of people diagnosed with major depressive disorder also meet the clinical criteria for generalized anxiety disorder. We have to ask, how do two conditions that present as extreme lethargy on one hand and relentless panic on the other coexist so frequently within the same brain? The answer lies in the brain's physical structure. Mental illness is a hardware malfunction, occurring independently of a person's character, strength, or willpower. The amygdala PFC circuit connects the brain's fear center to the logical prefrontal cortex. Normally, the cortex keeps the amygdala in check. In depression and anxiety, this connection frays. Signals block, leaving the amygdala unregulated. This fear center fires constantly, preventing basic motivation or rational calm. This structural circuit break traps a person in a constant state of threat or apathy, regardless of their gender or their external life circumstances. This damage is driven by the HPA axis, the body's stress response system. Chronic stress locks it on, continuously flooding the brain with cortisol. In sustained doses, cortisol is neurotoxic. It triggers neuroinflammation, actively degrading pathways between emotional and logical centers. This chemical flood is the unifying link. The same biological breakdown can lead to the withdrawal of depression or the hypervigilance of anxiety. Because the root is a physical breakdown, recovery isn't a matter of cheering up. It requires interventions that target the restoration of brain health. Since these conditions are rooted in the brain's physical biology, that biology can be repaired.
The brain can be rewired back toward health. It begins with immediate lifestyle controls. Exercise physically boosts serotonin levels, while restorative sleep allows the brain to replenish its depleted supply of neurotransmitters. It also requires avoiding substances that sabotage this process. Alcohol is a depressant that increases neuroinflammation, which only deepens the chemical imbalance. For moderate to severe cases, clinicians prioritize evidence-based treatments to stabilize the system. Cognitive behavioral therapy, or CBT, helps rewire destructive thought loops, while SSRI medications correct neurotransmitter levels to allow for better regulation. These aren't either-or solutions. Lifestyle changes and clinical treatments are complementary tools used to repair both the chemical supply and the structural wiring of the brain. In severe, treatment-resistant cases of major depression, doctors may use electroconvulsive therapy. By sending a brief, localized electrical pulse to the brain, this therapy acts as a physical reboot for brain chemistry, forcing a reset of the circuitry when standard medications and therapy are not enough. Long-term prevention is focused on protecting the HPA axis, maintaining healthy routines, building social connections, and using daily meditation all reduce chronic stress and keep the system from overloading. Anxiety and depression are physical diseases. By looking past the stereotypes and addressing the biological roots, we can use science to effectively identify, treat, and ultimately manage these conditions.